Okay, good evening, folks. Welcome to SUPERPoints. I hope you are all doing well. In today's episode, we would like to discuss some microbiology. As you prepare for your examination, microbiology is a must go subject. It forms the foundation to pretty much everything you study in medical sciences. So it's very important you know the basics in microbiology and also exam yield, high yield points. So we are going to discuss very high yield super points today. Please visit our website at superpoints.ai for more content as you prepare for this examination. So with this, let us start with this question. A 7-year-old girl presents with fever, sore throat, and tender cervical lymphadenopathy. Throat culture and blood agar shows complete hemolysis with a clear zone around colonies. Gram stain shows gram-positive cocci in chains. Which organism is most likely cause? All right, there are 4 options here. Choose the best option. I'll give you a few seconds. So the best option here is Streptococcus pyogenes. All right. Let us discuss why this is the best answer. First of all, whenever you see a question, think about the topic. What is the topic? That itself lightens your mind. The topic here is beta-hemolytic streptococci and streptococcal pharyngitis. Streptococci are differentiated by their hemolysis pattern on blood agar. Beta hemolysis, clear zone around colonies. Streptococcus pyogenes, Streptococcus agalactiae, and Streptococcus dysgalactiae. And alpha hemolysis, we have greenish discoloration. There is Streptococcus pneumoniae, viridans streptococci. Then there is gamma hemolysis, no clearing, Enterococcus faecalis, and some streptococci. So, when you see Streptococcus pyogenes, think about its basic structure. The basic structure here is Streptococcus pyogenes, chains of spherical. So they look like this, chains, gram-positive cocci. And the hemolysis is beta-hemolytic colonies on blood agar. And pathogenesis is also very, very important because it's a very common bacteria. So you see streptolysin S and streptolysin O, and there is a peptidoglycan layer, and there is plasma membrane, there is a cell wall, there is pili, there are exotoxins. And streptolysin O is a pore-forming toxin, and factor H binding helps streptococci escape polymorphonuclear neutrophils. The pathogenesis is it invades mucosa and skin, and immune-mediated damage in invasive and post-infectious diseases. The clinical manifestations, the most common thing, it presents with pharyngitis, and then there is a scarlet fever, skin infections like impetigo, and we have cellulitis causing red and swollen skin, invasive disease like necrotizing fasciitis with tissue destruction. Then there are immune-mediated sequelae like post-streptococcal glomerulonephritis and rheumatic fever. You see, these are highly, highly important things to remember. What are the immune-mediated sequelae of Streptococcus pyogenes? These two, post-streptococcal glomerulonephritis and rheumatic fever. So how do you remember Streptococcus pyogenes? The super mnemonic, that is like how to remember. This is the mnemonic I usually use. ABCs of Streptococcus pyogenes. A for group A streptococci, B for beta-hemolytic, precipitation sensitive, and C for clear zones of blood agar, that is beta hemolysis, and cocci in chains. So that is for the basic structure. And another mnemonic I use is pins. Streptococcus pyogenes causes pins. Pins cover the major diseases. P for pharyngitis and pyoderma, that is impetigo. I for immune-mediated diseases like rheumatic fever, glomerulonephritis. N for necrotizing fasciitis, that is flesh-eating fasciitis. And S for scarlet fever and strep TSS. Another mnemonic I use is extremely helpful is bring my pad, that is for beta hemolysis. Bring my pad, all right. B here is for beta hemolysis. PAD for 3 pyogenes, agalactiae, dysgalactiae. So bring my pad, that helped me a lot in my one exam. So bring my pad, beta hemolysis is seen in Streptococcus pyogenes. And add new video. I use this mnemonic to remember alpha hemolysis. New for pneumococcus and video for virulence. Okay. So bring my pad and add new video. So if you remember that one mnemonic, it helps you because these alpha hemolysis, beta hemolysis, gamma hemolysis, they can be very confusing. So a mnemonic like this would help you to remember these important organisms and whether they are alpha hemolytic or beta hemolytic. Now you might ask, what about the other answers? Why not Streptococcus pneumoniae? Streptococcus pneumoniae is alpha hemolytic. Staphylococcus causes pneumonia and otitis media. 3. Virulence streptococci. Virulence streptococci is alpha hemolytic, cause dental caries and endocarditis. Then there is the fourth option is Enterococcus faecalis, that is non-hemolytic gamma hemolysis associated with UTIs and endocarditis. So what is the super point here? Super point is the most important thing from this section. So the super point here is Streptococcus pyogenes is a beta hemolytic streptococcus, group A streptococcus, causing pharyngitis with complete clearing hemolysis around colonies and blood agar. Okay. So Streptococcus pyogenes is a beta hemolytic group A streptococcus, causing pharyngitis with complete clearing around colonies on blood agar. So remember this, very, very important for your examination. Let us go to the next question. A 65-year-old man with COPD develops fever, productive cough, and pleuritic chest pain. Chest X-ray shows lobar consolidation. Sputum gram stain reveals gram-positive lancet-shaped diplococci. Which virulence factor is most important for the pathogenicity of this organism? There are 4 choices here. Choose one best answer, and we will discuss this very, very high yield for your examination. So for this question, the best answer is number 4. Polysaccharide capsule inhibiting complement deposition. So why am I saying this is the correct answer? Let us see. The capsule prevents effective deposition of C3b and recognition by phagocytes. This allows the bacteria to evade innate immunity until anticapsular antibodies appear. It is the critical virulence factor. All right. So this question, what is the topic of this question? Always think about the topic. Just it takes you a couple of seconds. The topic here is virulence factors of Streptococcus pneumoniae, the role of the polysaccharide capsule. So when we talk about Streptococcus pneumoniae virulence, we have to think about its capsule, because it's the capsule that gives pathogenicity, and it is the capsule which we attack. All right, our antibiotics must attack the capsule, and also our vaccines must attack the capsule. Otherwise, the vaccine would be useless. So, Streptococcus pneumoniae is the leading cause of community-acquired pneumonia. The polysaccharide capsule is its major determinant of virulence. Unencapsulated strains are avirulent because they are easily phagocytized. So, let us see the structure. Remember the structure of Streptococcus pneumoniae. So, it is gram-positive vowel cocci, typically arranged end to end like this, like Diplococcus. There is a nice capsule. There is a cell wall with peptidoglycans. There is a plasma membrane, and there is choline binding protein attached to epithelial cells. There is a clear halo around the page due to the capsule that does not stain by the Gram method. And there is neuraminidase. Neuraminidase cleaves sialic acid that is present in host mucin, glycolipids, and glycoproteins. There is pneumolysine. It forming toxins secreted by the autolysis of the bacteria. Then there are autolysins. And the most important points are alpha hemolysis. Okay? And blood agar pneumococci produce round, glistening 0.5 to 2 mm colonies surrounded by a zone of alpha hemolysis. All right. So, alpha hemolysis, and the another most important point is bile salt solubility and aptogen sensitivity. That's a very, very important point. Bile salt solubility and aptogen sensitivity. That's why I added a SUPERPoint right here. Streptococcus pneumoniae is alpha hemolytic, aptogen sensitive, bile soluble, distinguishing it from viridant streptococci, which are aptogen resistant and bile insoluble. All right. So that is a very important SUPERPoint you need to remember. Then you might ask me, is there any way to remember this point like blindly for your exam? Yes, there is a mnemonic for this. I always use this mnemonic. Streptococcus wears a cap to escape. Imagine like a guy wearing a capsule. All right, so that will help you. Like for example, myself, I used this one. It's like a visual mnemonic you can also use. So imagine this bacterium like a diplococci here with glasses, and it's wearing a cap. All right, that cap reminds you capsule. All right, and then you can put this one, no C3b. It prevents opsonization and phagocytosis. So imagine like a thug or a thief. Streptococcus pneumoniae wears a cap to escape. So this visual mnemonic helped me a lot, and you can use this if it is helpful to you. So what about the incorrect answers? Number 1, pneumolysine mediated ciliary damage. Pneumolysine damages respiratory epithelial cells and impairs mucociliary clearance, helping colonization. However, it is not sufficient for systemic disease without the capsule. So you may find other things related to Streptococcus, but we are asking about its virulence. Okay, The question is about the virulence. What gives the virulence? So what about peptidoglycan cell wall preventing beta-lactam activity? The peptidoglycan cell wall is a structural, not a virulence factor. You see, the cell wall is not the virulence factor. Resistance to beta-lactams in Streptococcus pneumonia occurs due to altered penicillin-binding proteins, not peptidoglycan itself. So peptidoglycan does not matter when it comes to its virulence. Then IgA protease degrading secretory antibodies. This enzyme facilitates colonization of mucosal surfaces, nasopharynx by cleaving IgA, but it is not the primary determinant of invasive pathogenicity. So this is a high yield point, all right. So super formula is, how can you come to your answer by identifying the key points, all right, the certain keywords. So if you know these keywords, you can arrive at your answer in 5 seconds. Okay, for example, for a polysaccharide capsule, primary essential virulence factor of Streptococcus pneumoniae, and a thick polysaccharide capsule. A capsule inhibits complement deposition, specifically C3b, thereby preventing effective opsonization and phagocytosis by neutrophils and macrophages, allowing the organism to establish invasive infection. Clinical consequence, this is the key determinant enabling Streptococcus pneumoniae to cause community-acquired pneumonia, meningitis, bacteremia, especially in susceptible hosts like the elderly, young children, and immunocompromised individuals. So whenever they talk about Streptococcus pneumonia virulence factor, that is about polysaccharide capsule. All right, that's a very, very high yield point. So I am going to highlight this, the polysaccharide capsule. It is the primary and essential virulence factor of Streptococcus pneumoniae. All right, what about the super point? The most important thing you must remember from this question is the capsule of Streptococcus pneumoniae is the essential virulence factor preventing complement deposition and phagocytosis, making encapsulated strains pathogenic while unencapsulated ones are harmless. So encapsulated strains are virulent. Unencapsulated strains are not virulent, they are harmless. So it's a very, very important point you should remember. Next, let us see this question. A 70-year-old man develops pneumonia due to Streptococcus pneumoniae despite having received the pneumococcal vaccine 5 years ago. Immunologic testing shows antibodies against pneumococcal capsular polysaccharides. The infecting strain is found to have a capsule with a different antigenic composition. Which mechanism best explains this breakthrough infection? There are 4, all right? There are 4 options. Choose the best one. So the best answer here is option 4. Antigenic variation of capsule through genetic recombination. It's called capsule switching. In the previous question we have seen what is the virulence factor. And this question is about how this bacteria propagates and escapes the attacks. How does it protect itself? It protects using capsule switching. All right. See, they're extremely important and very interesting concept. So, if you see antigenic variation of capsule through genetic recombination, this is called capsule switching. Streptococcus pneumoniae can exchange DNA and produce new capsular serotypes, escaping existing antibody protection. So, what is the topic? Just a couple of seconds. The topic is Streptococcus pneumoniae, capsular serotype specific immunity and capsule switching. Immunity to Streptococcus pneumoniae depends on antibody against capsular polysaccharides. At least activates the classical complement pathway, C3b deposition, opsonization, and phagocytosis. However, this immunity is serotype specific. Remember the image I have showed you earlier. Okay, so this is like the capsule here. This capsule, folks, is what gives the virulence. Okay, so antibodies effectively destroy the bacteria when you have this capsule specific immunity. All right. So this capsule switching happens. So what happens? The capsule has changed. So it got a completely new capsule. So now the same antibiotics unable to destroy. The same antibodies are unable to destroy the bacteria because the bacterium now got a new capsule. So this is an extremely important super point. Immunity to Streptococcus pneumoniae is serotype specific and mediated by anticapsular antibodies, but capsule switching through genetic recombination allows new serotypes to evade immunity, explaining recurrent infections. So why do you get recurrent infections? People might ask you, hey, I got pneumococcal vaccine, and why? I'm still getting infections, recurrent infections. What is going on? Why do I need these vaccinations year after year? Some people may ask you that question. The answer is the bacterium using capsule switching. Using capsule switching, it is changing its capsule. So the previous antibodies you got from that vaccination, those antibodies are no longer effective now. All right. So that's a very interesting high yield point. So how do you remember this? The mnemonic here is pneumococcus, caps can switch. All right, just remember that. Pneumococcus, caps can switch. Pneumococcus changes its cap to switch past vaccine immunity. Or in other words, if you want to use the earlier image I have showed you, just imagine this thief changing his cap. So he's changing his cap. So it may be a red cap today, and tomorrow if you are still looking for a red capped guy, you won't find him because he is no longer wearing that cap. He changed his cap. Today he's wearing a white cap. So you can use that visual mnemonic also to remember this concept. What about the incorrect answers? Why not option 1, failure of alternative complement pathway? Protection is mainly through antibody driven classical pathway, not alternative. So here we are using classical pathway. Then lack of antibody to pneumolysine. Pneumolysine is a toxin, but immunity depends primarily on capsular antibody, not anti-pneumolysine. Then number 3, neutrophil oxidative burst decline. Aging increases risk of infection. But here the problem is serotype escape. So what is the super formula? Super formula is arriving at the correct answer in few seconds, like 5 seconds. You should know the answer by recognizing the keywords. All right, every question will have certain keywords. You need to identify those keywords, and those keywords will take you to the answer in a few seconds. So super formula here is key mechanism of immune evasion where Streptococcus pneumoniae undergoes horizontal gene transfer to exchange its capsule biosynthesis locus, resulting in an antigenetically different polysaccharide capsule. This allows the bacterium to escape serotype-specific immunity conferred by prior infection or vaccination, as protective antibodies are directed against the original capsule serotype and are ineffective against the new serotype. This explains recurrent pneumococcal infections in vaccinated or previously exposed individuals, highlighting the limitation of capsule-based vaccines. So whenever you see those things, this guy getting recurrent infections, the Streptococcus pneumoniae is using evasion. Why is this? Then the answer is capsule switching. All right. So the super point, the most important thing you must remember from this is this one. Capsular antibody provides serotype specific immunity to Streptococcus pneumoniae, but capsule switching through genetic recombination creates new serotypes that evades existing immunity, leading to breakthrough infections. So capsule switching. All right, folks, remember that important concept. Let's go to the next question. A 58-year-old man presents with fever and a productive cough. Chest X-ray shows lobar consolidation and sputum gram stain reveals gram-positive Lancet Staphylococcus. The colony is grown on blood agar or alpha-hemolytic. Which laboratory test result confirms the organism as Streptococcus pneumoniae rather than Virulence streptococci? So I already told you the answer in the discussion. So this is about how do you identify Streptococcus pneumoniae and how do you differentiate it from Virulence streptococci. We have 4 options here. Go ahead and choose the best option in the next few seconds. So here, the correct answer here is option 4, aptogene susceptible and bile soluble. Why? I already showed you. First of all, think about what is the topic. The topic is laboratory identification of Streptococcus pneumoniae, aptogene sensitivity and bile solubility. So both Streptococcus pneumoniae and Virulence streptococci are alpha hemolytic on blood agar. All right. So add new video. All right. Add new video. A is for alpha hemolytic and new is for pneumonia, Streptococcus pneumonia. And Virulence streptococci, that is for Virulence streptococci. So these are alpha hemolytic on blood agar. To differentiate them, Streptococcus pneumoniae is aptogene susceptible and bile soluble, whereas Virulence is aptogene resistant and bile insoluble. Alright, so that's a very, very important concept here. So these 2 things are important: bile salt solubility and aptogene sensitivity. And add new video. All right, add new video. That means for alpha hemolysis we have pneumococci and Virulence. So how do you remember this? This can be quite confusing, to be honest with you. I used this mnemonic and it helped me a lot. So the super mnemonic here is, I am already obsessed with Streptococcus pneumoniae. Just memorize that one. I am already obsessed with Streptococcus pneumoniae. So here A is for alpha hemolytic. O is aptogene sensitive. So link that O with one S and B with the another S. All right. So aptogene sensitive and bile soluble. So that's why if you say that many minutes, I'm already obsessed with Streptococcus pneumoniae, I'm already obsessed with Streptococcus pneumoniae, you will remember that. And just capitalize OB and SS. All right. So that's a very good mnemonic, and that's what I use in my examination. And I am sure that would be very helpful to you. A for alpha hemolytic, O for aptogene sensitive, B for bile soluble. Now, What about incorrect answers? Why not option 1, aptogen resistant, bile insoluble? So aptogen resistant, bile insoluble, it's about Virulence streptococci. So these two tests are helpful to differentiate Streptococcus pneumoniae from Virulence streptococci. The next option to grows only on chocolate agar with antibiotics. Chocolate, always think about Neisseria, alright? So not Streptococcus. What about aptogen susceptible, bile insoluble? So I don't think of any organism that fits into that option. So what about super formula? Super formula is identifying the keywords and going to your answer like in 5 seconds. So whenever you see alpha hemolytic streptococci and it is aptogen susceptible and it is bile soluble, and so whenever you see those and then lancet shaped diplococci, the answer is Streptococcus pneumoniae. All right. So very important question because it's everywhere. It's killing millions and millions of people around the world. We have antibiotics, we have vaccines, but does not matter. That's why examiner wants you to know everything about Streptococcus pneumoniae and you should go well prepared. So what about the super point here? Streptococcus pneumoniae is alpha hemolytic, aptogen sensitive and bile soluble, whereas Virulence streptococci are alpha hemolytic, aptogen resistant and bile insoluble. So in this question, they want you to know about how do you differentiate between Streptococcus pneumoniae and Virulence streptococci. And that is the key answer, folks. Very good. And let us go to the next question. A 32-year-old woman presents with fever and painful thigh abscess. Culture of the pus shows gram-positive cocci in clusters that form golden colonies on blood agar. When incubated in plasma, the organism produces a fibrin clot within hours. Which virulence factor is responsible for this diagnostic finding? All right. So go ahead and find your answer here. So this is actually a very easy, very easy. If you just read the question, you can easily answer it. The correct answer here is number 2, coagulase converting fibrinogen to fibrin. Okay, it's already there, already a fibrin clot, and it converts fibrinogen to fibrin, producing a clot, key test for Staphylococcus aureus. So this question is about what is the key test for Staphylococcus aureus. So Staphylococcus aureus identification, role of the coagulase test. Staphylococcus aureus is identified in the lab by the coagulase test, all right, which distinguishes it from coagulase negative staphylococci like Staphylococcus epidermidis and Staphylococcus saprophyticus. That is also another important organism. It causes UTIs in young women. Its colonies appear white to golden. Actually, the name says it all. Staphylococcus aureus. Aureus means gold. So when you see gold, think about Staphylococcus aureus. And it is catalase positive. So when you see Staphylococcus aureus, so gram-positive cocci in clusters, catalase positive, coagulase positive, facultative anaerobe, often taking a bunch of grapes appearance. All right, it looks like bunch of grapes appearance, and coagulase positive, I already told you, and coagulase negative staphylococci are different. All right. So the most important laboratory test used to distinguish Staphylococcus aureus from other staphylococci is the coagulase test, as the enzyme coagulase converts fibrinogen to fibrin, producing a clot. Okay, so remember that super point, extremely important. Coagulase positive colonies on blood agar with beta hemolysis, clear zones, and golden yellow pigmentation. So beta hemolysis grows on blood agar, often beta hemolytic, ferments mannitol on mannitol salt agar, Staphylococcus fermenting mannitol, and it produces many toxins. Again, it's very, very important, these toxins, even though they are pain in the neck to remember. Take time to memorize them because everything is important. For example, enterotoxins, heat-stable superantigens stimulate massive T-cell cytokine release, causes food poisoning. All right. Then there are exfoliative toxins, ETA, ETB. Serine proteases split desmoglein 1 in epidermis, causes staphylococcal scalded skin syndrome. And then there is a toxic shock syndrome toxin. All right. So when women leave tampons, it can grow and it can produce toxic shock syndrome. And then there is very, very important, it's a growing problem around the world, community acquired MRSA and MRSA. All right, MRSA, resistance due to acquisition of MACA gene encoding altered penicillin binding protein PBP2A with reduced affinity for beta-lactam antibiotics. And then there is panton-valentine leukocidin, and this leukocidin causing WBC destruction, tissue necrosis, leading to severe skin, soft tissue infections, necrotizing pneumonia. The SUPERPoint here is Staphylococcus aureus causes disease via multiple toxins, enterotoxins, food poisoning, TSST1, toxic shock, exfoliative toxins, scalded skin, PVL, necrotizing infections, while MRSA emerges from MACA encoded PBP2A, making it resistant to beta-lactams. So another important concept is autoinfection and reservoir, because the anterior nares are the primary reservoir of Staphylococcus aureus. So how do you remember? I will be honest with you. I was always confused by these organisms, that always I used visual memories to remember these organisms. In this question, I would like to share you one of my favorites. This is the super mnemonic here. Staphylococcus aureus, golden grapes eaten by copper cat. So I always imagined golden grapes eaten by a copper cat. All right, because Staphylococcus aureus, the aureus itself means gold. So golden grapes, this organism organizes itself like a cluster of grapes. And then imagine a copper cat. Copper like coagulase and cat for catalase. Okay, so coagulase and catalase, those two are important tests when we talk about this Staphylococcus aureus. So golden grapes eaten by copper cat. So that helped me a lot. Staphylococcus aureus, we have to do these two tests, like catalase positive and coagulase positive. So remember this cat and remember these golden grapes on one side. Remember this cat and write coagulase positive and catalase positive. So golden grapes eaten by copper cat, that would be a very nice mnemonic. All right. So why not other options? Why not protein A? It prevents opsonization by binding IgG-Fc, but not diagnostic. All right. What about exfoliative toxin? It causes scalded skin syndrome unrelated to clotting. Why not TSST1? It causes toxic shock syndrome, not diagnostic in culture. So why these important things? Like, I mean, this is about differentiating Staphylococcus aureus and coagulase negative Staphylococcus. They have clinical significance too. I told you already, like Staphylococcus saprophyticus, it causes UTIs in young women. And because you see coagulase test is positive here and a negative here. Catalase test is positive in both cases, but coagulase test is positive here but negative there. All right, and they also have different clinical profile. This Staphylococcus aureus causes skin, soft tissue infections, abscesses, pneumonia, osteomyelitis, endocarditis, food poisoning, TSS. Whereas Staphylococcus epidermidis and saprophyticus causes device-related infections, catheters, prosthetic valves, shunts, endocarditis, opportunistic infections. So, what is the SUPER formula? SUPER formula is about identifying a few keywords and arriving at the answer like in 5 seconds. Okay, what are the keywords here? The keywords here, when you see a patient with abscess or purulent skin infection, whenever they say grape-like clusters, whenever they say golden yellow colonies, remember gold, aureus, all right. Then whenever they say catalase positive, and whenever they say coagulase positive, they are talking about Staphylococcus aureus. All right, folks, extremely important because it kills millions of people. We already saw food poisoning, skin infections, abscesses, toxic shock syndrome, community acquired pneumonias, and methicillin-resistant infections. It literally kills millions of people every year. So that's why it's a very, very important, clinically important organism. So what is the SUPERPoints here? I want to give you 2 SUPERPoints here. Staphylococcus aureus is coagulase positive, golden, often beta-hemolytic, highly virulent, while coagulase negative staphylococci are coagulase negative, less virulent, mainly cause device-related or opportunistic infections. Staphylococcus aureus is identified by the coagulase test, where coagulase converts fibrinogen to fibrin, producing a clot that distinguishes it from other staphylococci. So when as a visual mnemonic, you can also do one thing. Put a nice fibrin clot in the cat's hand. All right. So imagine that cat is holding a nice test tube, and in that you can say there is a fibrin clot, or even on its body you can say fibrin clot. So you have to do these things to remember on your examination day. All right, when you have so much going on, these mnemonics help you to go to the right answer. All right, and I want to do a few more questions on this because this is a highly important organism. Next thing, a 36-year-old nurse develops a skin abscess that cultures positive for Staphylococcus aureus. Infection control staff remind her that 10 to 30% of healthy individuals carry this organism asymptomatically at its major reservoir site. What is the most common site of Staph aureus colonization in humans? All right, this is a very straightforward question. The most common site of Staph aureus colonization in humans. You have 4. All right, choose the right one. So the right answer here is option 3, all right, anterior nares. So this is a very, very interesting question. So anterior nares, principal reservoir, major source of shedding and transmission. The topic here is Staphylococcus aureus, human reservoir and colonization sites. Staphylococcus aureus is a gram-positive, catalase positive, coagulase positive coccus. It is carried asymptomatically in 10 to 30% individuals with higher rates in healthcare workers and hospitalized patients. All right, just remember this one. So, anterior nares, primary reservoir of Staph aureus, making nasal carriage the key source for transmission and infection. So, if you are picking the nose, you might give Staph aureus to somebody else. All right. I have patients, when I tell them you have this cellulitis or you have this abscess, they throw a fit. They say, it does not make any sense. Why did I get this abscess? Why did I get this cellulitis? Where did I get this? I take all precautions. I tell them, it is in your nose. It is right there in your nose, my friend. So, disease in the nose. Most community-acquired Staph aureus infections are auto-infections from nasal or skin colonization for external, not external transmission. Okay, so most community-acquired Staph aureus infections are auto-infections. So it is going from the person's nose to different parts of his or her body. So here you can either just remember that without any mnemonic, or if you want a mnemonic, you can say golden grapes in the nose. All right, golden grapes. Just imagine golden grapes in this area. You will not forget it. So golden colonies, grapes, cocci in clusters, nose, anterior nares, main reservoir. How about other things? Oropharynx may harbor streptococci and other flora, but not the main Staph aureus reservoir. Skin folds, secondary colonization from nasal carriage, not the primary site. Gastrointestinal tract, less common. All right. So, how about super formula? I told you, super formula is about finding certain keywords, right? So, whenever you see gram-positive cocci in clusters, golden colonies, catalase positive, coagulase positive, and whenever they say anterior nares, then you have to pick this question, this answer, Staph aureus. And super point from this is anterior nares are the major reservoir of Staphylococcus aureus, explaining its frequent transmission from carriers to others. All right, folks, that's very interesting question. Next one, a 27-year-old man develops a painful abscess on his leg after a minor abrasion. Culture shows gram-positive cocci in clusters, catalase positive, coagulase positive. He has no hospital exposure or indwelling devices. What is the most likely source of this infection? All right, I already told you auto-infection. Auto-infection. All right. So this question is also about emphasizing what I already told you. There is anterior nares, the most common site, and auto-infection, all right, is the most common way to get this infection. Most community-acquired infections are auto-infections. So when patients throw a fit, how did I get this? Who gave this infection to me? Tell them that news slowly. Well, you gave it to yourself. All right. So that helps them to be sympathetic to themselves. All right. So remember this: anterior nares and most community acquired Staph aureus infections are auto infections. So they go from here or from here. Next, and staph starts from self. If you want a mnemonic, staph starts from self. All right, you give it to yourself. All right, why not food ingestion? No. Why not respiratory droplets? That is for staph, pneumonia, influenza, TB, not for staph aureus. Why not insect vectors? No, insect vectors are not involved in staph aureus infections transmission. So what about super formula? Whenever you see a symptomatic colonization of anterior nares and skin, minor skin trauma, auto-inoculation of patient's wounds strain into deeper tissues, catalase positive, coagulase positive, gram-positive cocci in clusters, then they are talking about community-acquired Staphylococcus aureus skin soft tissue infections. The super point here is most community-acquired Staph aureus infections are auto-infections from nasal or skin colonization, not external transmission. So washing your hands might save you from yourself. All right, washing your hands might save you from yourself. Right, that is very, very important clinical truth. Next question is, a 24-year-old man presents with a painful fluctuant skin abscess. Gram stain of pus shows gram-positive cocci in clusters during Pathogenesis, the organism first attaches to host fibronectin via surface proteins. Major tissue damage then occurs when a pore-forming toxin inserts into host cell membranes, causing cytosolic leakage and destruction of epithelial cells and neutrophils. Which virulence factor is responsible for this cellular injury? So this is a very interesting question. Go ahead and choose one of the best answers among these four options. So the best answer here is 3, alpha toxin. So here, first you need to identify the organism. All right. So they are telling you something, gram-positive cocci in clusters. All right. Then they are saying it attaches to host fibronectin via surface proteins. That's not much helpful. And they are saying a painful fluctuant skin abscess. All right, that's very important information. So by that, you already should be thinking about Staphylococcus. Then it's a pore-forming toxin. All right. So this question is about what is that pore-forming toxin secreted by Staphylococcus aureus. All right. That is the alpha toxin. So you need to remember what kind of toxins are produced. So what is the topic here? Staphylococcus aureus virulence factors, alpha toxin mediated tissue injury. Staphylococcus aureus uses adhesions, fibronectin binding proteins to initiate colonization, but tissue destruction is mainly due to toxins. The most important cytotoxin is alpha toxin, which inserts into cell membranes and forms pores. So alpha toxin, it forms pores. All right. So cytotoxin, we have to remember various toxins. Okay, enterotoxin, food poisoning, then exfoliative toxin, serine protease split desmoglin 1 in epidermis. It causes staphylococcal scalded skin syndrome. We have toxic shock syndrome toxin. We have PVL. We have MACA. So cytotoxins here. All right. So how do you remember this? Just memorize. Like, that's very important. I also used this visual image, and this image just stayed in my mind, and it helped me a lot. So I imagine this bacteria like a boxer, and I put this alpha on it, and every time it punches, it forms holes. All right. So it forms a pore in membrane. So alpha toxin punches holes. Remember like that. Alpha toxin, it's like a boxer, it's punching holes. So that causes cell damage, leakage, and neutrophil death. So this image just stayed in my mind, and that might help you to remember this important point. But the best way is also to remember each toxin and what it causes, because every toxin can come as a question on its own. For example, alpha toxin abscesses, TSST1 shocks, exfoliatin scales, and enterotoxin vomits. All right, these are like staph toxin. Just memorize that. Alpha toxin abscesses, TSST1 shocks, exfoliatin scales, enterotoxin vomits, like that. If you say that many times, you will remember that. So alpha toxin causes tissue damage and abscesses. TSST1 causes toxic shock syndrome with fever, rash, hypertension. Exfoliatin causes scalded skin syndrome, widespread paling. Enterotoxin causes food poisoning and with vomiting and diarrhea. So if you remember that mnemonic, you would be able to answer any question from that section. So incorrect answers: why not protein A? It prevents opsonization by binding IgG-Fc but not responsible for pore formation. Coagulase helps wall off infection but does not lyse cells. Then TSST1, superantigen that causes toxic shock syndrome by cytokine storm, not direct cytolysis. So super formula is identifying the keywords so that you can arrive at the answer in like less than 5 seconds. Whenever you see a primary cytolytic exotoxin of Staph aureus, a pore forming toxin, and it creates a transmembrane pore, and it leads to osmotic lysis of a wide range of host cells, including epithelial cells, endothelial cells, monocytes, neutrophils. The toxin is a key mediator of tissue necrosis, and it leads to the formation of abscesses. So basically, pore forming cytolysin of Staph aureus. So if you see those words, they are talking about alpha toxin. All right, folks, that's very, very important. And the one thing you must remember as a super point is this one: the alpha toxin of Staph aureus is a pore forming cytotoxin that lyses epithelial cells and neutrophils, making it the major mediator of local tissue destruction. So remember these things. It's a very, very important concept. And next question: a 23-year-old college student presents with fever, cough with bloody sputum, and pleuritic chest pain. Chest X-ray shows multiple bilateral cavitary infiltrates. 2 weeks earlier, he had undergone incision and drainage of a skin abscess. Gram stain of sputum shows gram-positive cocci in clusters. The isolate is found to carry the gene for Panton-Valentine leukocidin, PVL. Which of the following best explains the mechanism of tissue damage in this patient's infection? So we have like 4 options here. You need to choose one of the 4. So the best answer here is option 3, exotoxin mediated leukocyte destruction leading to necrosis, Panton-Valentine leukocidin. PVL is a pore forming exotoxin that lyses neutrophils, releases of enzymes, necrosis, and cavitary lesions. So what are they talking about? PVL is about community acquired MRSA, all right, community acquired MRSA, necrotizing pneumonia, and that is the topic here. Community acquired methicillin resistant Staph aureus, especially the USA 300 strain, is a highly virulent pathogen responsible for severe skin and soft tissue infections and life-threatening necrotizing pneumonia in young, otherwise healthy individuals. These infections often follow or coexist with the skin abscesses and are characterized by fever, hemoptysis, cavitary, skin, lung lesions, and rapid clinical deterioration. The key virulence determinant in this presentation is Panton-Valentine leukocidin, a pore-forming exotoxin that specifically targets neutrophils and other leukocytes. So PVL is an exotoxin, all right, and it's a very, very important toxin. I already showed you here. This is a PVL, all right. So PVL, what is it doing? It's causing WBC destruction, tissue necrosis, and the lungs, they are completely destroyed here, causing necrotizing pneumonia, so leading to severe skin soft tissue infection. So PVL is a very important exotoxin you need to remember, and put this to memory. PVL causes necrotic community acquired MRSA. That is the super mnemonic here. PVL causes necrotic community acquired MRSA. And you can also think about the pathogenesis by going like this: P for pore forming and V for very lethal to leukocytes. All right. What is PVL doing? pore forming exotoxin, very lethal. As I told you, it is destroying the lungs, severe, rapidly progressive infections, and leukocytes, neutrophil lysis. So it's necrotic. The toxin is the direct cause of necrotizing tissue damage, and it is a hallmark of community acquired MRSA, all right, especially USA 300 clone. What about the other things? The other things like capsule, Streptococcus pneumonia and Neisseria meningitis aid in immune evasion but are not responsible for necrotizing pneumonia in CA-MRSA. What about endotoxin? Endotoxins are seen only in gram-negative, right? MRSA is gram-positive, so we don't talk about endotoxins here. And what about biofilm formation? That is seen in staph epidermidis, prosthetic device infections, not necrotizing pneumonia. All right. So next we have to talk about super formula. Super formula is about arriving at the correct answer in 5 seconds. Okay. What are the key terms you can identify? Pore forming exotoxin, community acquired methicillin resistant staph aureus, USA 300. All right. So neutrophils are being lysed, transmembrane pores are being formed. So the key virulence determinant for necrotizing infections. So when you see those things, they are talking about Panton-Valentine leukocidin, PVL. All right. So the super point here is community acquired methicillin resistant Staphylococcus aureus, CA-MRSA, particularly the USA 300 clone, is associated with severe skin, soft tissue infections and necrotizing pneumonia. Its virulence is largely due to Panton-Valentine leukocidin, PVL, a pore-forming exotoxin that lyses neutrophils and other leukocytes, releasing enzymes that damage tissue and promote necrosis. All right, folks, those are the main things I wanted to share with you today. Basically, Staphylococcus and Streptococcus, those two organisms we talked about today. And they're extremely important, all right, extremely important because they are most common. They are everywhere. If you are a primary care doctor or any specialty, you are, for example, if you are in gynec, it is there with the toxic shock syndrome, all right. If you are in if you are a cardiology, it is there on the valves. If you are a dermatology, it is there on the skin. If you are a gastroenterology, it is there causing food poisoning. So it's everywhere. So that's the reason it is extremely important. And I hope you got something from these questions. Please visit our website www.superpoints.ai and get more content as you prepare for your examination. And I will see you in the next episode. Please watch our other episodes from other topics also I have been discussing. Last week I talked about cardiology. So go and watch that also. We discussed about very important super points from cardiovascular system. All right, folks, I will see you in the next episode.